Hi, everybody. It's me. It's Harry Kestler from Science and Math. I'm here to do a coVIDeo and tell you about where things are going. Um, I always wondered what I would do for an end to the pandemic, and unfortunately, there isn't an end to the pandemic. It's basically the pandemic becoming an endemic. So the ending here is really not an ending once whatsoever. It's about moving on to a different phase. And oh, by the way, maybe even taking off our masks on account of because we don't need that anymore. Or we, excuse me, I don't mean to say that at all. What I meant to say is that our masks are going to be with us and we can use them whenever we need to. But I'd like to tell you about some of the things that are going on right now. First of all, the virus is not gone. The virus will be with us. The virus will be with us probably for F's. And I'll get into that in a second. But we are moving into a different phase. We don't need to wear masks now, but we may want to. Nobody is ever going to tell anybody you can't wear a mask. And I am certainly going to hang on to my mask. I will hang on to my mask and I will bring it back as I need it. If I need to protect somebody in my family because they have it, or myself because I'm worried about the levels of virus, I will bring it back in an instant and I will put my mask on. And certainly everybody has a right to protect themselves and their family in that regard. I still want to, the levels of virus are very low right now, but I still want to tell you that I highly recommend vaccination. Vaccination makes a world of difference. You are 20 times more likely to die from SARS-CoV-2 if you are unvaccinated. It is still the best thing you can do at this point. But things are much different right now. We are in the ending phase of the Omicron virus. The Omicron virus outbreak actually took out a lot more people than the Delta virus did. There were more deaths with the Omicron, even though the Omicron virus was a, shall we say, less pathogenic, a kinder, gentler virus than Delta. The reason is more people got infected. Omicron was much more infectious, so it went looking for everybody. And if you are virus naive at this point, if you've never been infected, if you've never been vaccinated, you are still at risk of this virus right now and into the future. But it is kind of time to move on here. Why is it time to move on? Well, number one, if you look at the amount of virus that's right now in Lorain County, it is quite low. Looking at the virus here, we have, of the last month, we are at extremely low levels of virus right here. We're tracking very low amounts of virus at this point. Also, the second thing I want to point out about this data is the test positivity rate. And what this means is that that the number of people getting tested. So if 100 people got tested, 5 people became positive and 95 were negative. That's the lowest. Test positivity rate is the lowest it's been in a while, suggesting that there is very little virus circulating in our community. And I'll get more about that in a second. Another thing I want to remind you all about is the level of vaccination. I am 66 and 66 in a month old. And I'll tell you that I'm in my group of people, 91% in Ohio. We still have much more to gain by getting more people vaccinated. And it protects all of us, including the people who are unvaccinated. If you look at the amount of virus that is in the hospitals, that's also very good news here. We are now looking at 70% available or 30% available beds, which is when it's down to 70% like that, or 80%, it means a hospital can act as a hospital. It doesn't have to be a COVID center. When you get into these really high levels, it really becomes nothing more than one disease hospital. And of course, there are many diseases that people face, and they need to. So the hospitals are in good shape. We also know something else. There's a little something else that we know about the virus, and that is where it is. Now, even though not everybody gets tested, and I'm going to add this, there were probably some people who got sick last month. And if I got sick last month and didn't know it, and of course, if I didn't know if I was completely asymptomatic, I could be shedding virus. And that would be kind of scary because I wouldn't know I was. Well, if you flush, we know. Because we monitor wastewater, we monitor what people, and we can look at this, at the virus for various areas, and you can see the Midwest, which is us. We lead the nation. Our levels are the lowest down here of all of the different areas. So we are getting to a place where there is less and less virus in even among healthy people who are not showing symptoms. So that is great news. We can also, by the way, use this wastewater to predict outbreaks. If we saw what was going on back here in December, we would have known that we were going to get hit in late December, January, which we did. These are the hospitalizations, the clinical cases in there. So this is all good news. We have very little virus circulating among us. It's time that we, come out of our bomb shelters, to use something that only people of my age would understand, and move on. We know that for fact, here's the data for all of Ohio from today. You can see we've got very low virus. We have a decreasing people in hospitalization and a decreasing number of people in ICUs. Sometimes it's good to look at the number of people in ICUs, because hospitals can change bed availability. They can fluctuate with that. They can play with that number. This is the number of people in an ICU with COVID. And you can see that number is also decreasing. So all around, good news. Will we get another bout of the virus? I think we will. I have no doubt that we will, but I think we have to kind of monitor that as it comes and then make decisions as we go into it. Let me go back to that case. Let's say I had a case that I didn't know of, that I was Omicron positive in January. Let's just say that. And if I was, I actually kind of hope I was, because that means that I've been boosted with the Omicron virus directly. So I have a very specific set of immune responses that are going to persist for several months and years, depending on the type of immune response. So we are moving to a great kind of place. I never thought I would appreciate the color yellow so much as I do right now. It is just a gorgeous color, and all that yellow, especially in most of Northeast Ohio, indicates that it isn't just Lorain County, Cuyahoga County. It is, the virus is going. Another thing that works in our favor at this time right now is there's not going to be a lot of travel for the next few months, and so that also works in our favor here. All right. So in the United States, the news is it's not just an Ohio phenomenon, although we are doing better than most places. We were the worst several weeks ago, and we are becoming the best now. Now, I am very much encouraged by the slope of this curve and the smoothness of it. The fact that it stays consistently dropping suggests to me that there are truly no more reservoirs for this virus to go to. There are no more nooks and crannies. Unlike like in England, you'll see this curve going like this, and then it's kind of like plateaus for a while and then drops down and further and further and further. That is not what's going on here. It looks like we are really getting a good clearing of this virus. And the virus we're talking about is the Omicron virus, just so that we know that is what is circulating in the United States exclusively at this point in time. Other viruses have come and gone. All right. So what does that all mean? There are, and I think you've heard me talk about this before, there's actually several coronaviruses that already are in our population. Such as human coronavirus 229E, NL43, and OC43. I want to talk about that one a little bit later, and HKU1. I don't know what HK stands for. I would like to think it's Harry Kestler, but I'm sure it's Hong Kong. And then I think there might be, of the four, these are the original four, I'd like to add a fifth one to this list. And these are going to be present probably every year at the same time. That December, January period of time, we are going to see an outbreak of the Omicron virus or something similar to it. Now, I got to tell you something about this, and that is that we, I think some of you have heard me talk about this before, that there is a thought that something called the Russian flu, which is in the late 1800s. In the late 1800s, there was a flu in Russia. It became a worldwide kind of flu. The word flu, by the way, stands for, some of you have heard this before on my coVIdeos. Influenza means influence in Italian. And the full expression is under the influence of the cold, which really kind of talks about a lot of things in there. There is this idea that Russian flu, by the way, this is a little cartoon that the French put out back in the 1800s, talking about how, this flu was coming in and killing people and doing things. We think it might actually be a coronavirus. And the one that we think it might be is the coronavirus we were just talking about, the H coronavirus OC43. And that has been going around and around and around. You'll notice the publication date of this publication is prior to, there's no talk of SARS-CoV-2. But this paper is looking at respiratory infections in China. It's a Chinese study, but it's looking at them from I think 2010 to 2015 when they're looking at it. And what you can see is there are the endemic friends of SARS-CoV-2 Omicron. What I'm proposing is going to be the fifth coronavirus that circulates in the population. And if you look at these numbers here, you can see that there is, first of all, these viruses are treated in different ways, sometimes as an outpatient, sometimes as an inpatient. And you have influenza, you have parainfluenza, respiratory syncytial virus. You also have human metapneumovirus. You have coronaviruses, that's this one right here, adenovirus, bocavirus, and human rhinovirus. All of these things are the things that cause colds. And I just want to point out that the big numbers here. First of all, respiratory syncytial virus is the one that is most likely going to end you up in the hospital. And respiratory syncytial virus is one that still circulates around today. Influenza is more likely going to be treated as an outpatient kind of disease. And then the coronaviruses are somewhere less. But that number would probably go up when the SARS-CoV-2 Omicron virus joins this group of viruses here. So all of this points to what I would say is a change. And maybe we're going to put masks back on again. We will certainly be able to do that. That's not a problem. And you certainly are entitled to wear a mask. Make a decision based on your own personal set of information. Make a decision about whether you're going to continue to wear masks or not. I will tell you that I have already made, I told my students this today, I have already made a decision. We're going to wear masks in microbiology lab while we're doing inoculations, just because it's good practice, just because it is going to help us from any kind of contaminations. And I like it. I like that part of the story. And so that's, I guess, a happy kind of a story. I am glad to have been helpful in this whole story, and I hope that you all. I mean, it's been a long haul. I started making coVideos 2 years ago, and maybe this is the last one, or maybe I'm going to be doing something else. I don't know what. There is a chance that more diseases could arise in the future. I just told my infectious disease class today that I would not be surprised if there were new ones coming our way, because there is such a because of the way the world is today, because of the global nature of the world and how we reach out into all kinds of places. But it's good to be talking to you. It's good to see you. It's gonna be good to see your chins again. And everybody should stay healthy. Stay healthy, everybody, and stay safe. And I'll talk to you later. Thank you for tuning in.